Okay. This morning we're going to be talking about the Vinci robot. Now, we have talked about surgical uses before, including cardiothoracic surgeons as well as gynecological surgeries. This morning we're going to find out how this is changing the way throat cancers are being treated by ear, nose, and throat specialists. Now, we have Dr. Arrieta with us and Dr. Molina with us this morning. They both work together on using this robot to perform surgeries. We're going to start with Dr. Arrieta. Good morning. Thanks so much for being here.
Thanks for having us. Good morning.
When we're talking about throat cancers, what usually are we speaking of?
The types of throat cancers we're starting to address with the robot are in what we call the oropharynx, which is basically the back of the tongue and the tonsil area. And this is where the robot has changed our approach to treating these cancers.
What are the traditional treatments?
Traditionally, this is a cancer that has shifted towards being treated with a combination of chemotherapy and radiation, principally because of the morbidity involved with accessing this area with surgery, and that is beginning to change once again.
This is changing because of the use of this Da Vinci robot. The surgical option previously was pretty invasive. Tell us about that.
Yeah, correct. Previously, in order to access this area, to both remove the tumor and reconstruct the defect left, could involve some extensive surgery with significant morbidity involving sometimes cutting through the jawbone or the mandible and requiring a temporary breathing tube or tracheostomy tube, which is now changing because of the robot, where we can access this area principally just through the mouth and obviate the need for such extensive type procedures.
And also, you would no longer, previously you had to do reconstructive surgery. Did you do that all in one go, or did you deal with the cancer first?
Yeah, typically if that was the procedure that was going to be done, it was all done in one setting.
Wow.
So it involved a very lengthy operation and an extensive stay in the hospital, which we have found that we've been able to reduce significantly with the robot, in the hopes that now we can use less intensive therapies afterwards with less intensive radiation and chemotherapy, and not see the long-term complications of those treatments.
What are some of the long-term complications of chemotherapy and radiation?
Principally, what we see traditionally is long-term problems with swallowing, or what we call dysphagia, and dryness to the mouth and throat area. With our ability now to hopefully reduce the extent of the treatment, we're seeing less of that side effect on a long-term basis.
Okay, and Dr. Arrieta, you work with Dr. Molina using this robot to perform these surgeries, so we're going to talk to him next.
Great, thanks for having us.